But first, your medical minute. Lack of sleep can not only leave a child grumpy, but can impact their overall development. Dr. Rasmus, medical director of Idaho Sleep Clinics, gives us a closer look at sleep deprivation and what it means for your kids.
Dr. Rasmus, what is sleep deprivation?
Sleep deprivation is the buildup of sleep debt. So as we become sleep deprived throughout the course of the week, it adds up in chunks. You might be 20 minutes behind one night, 10 minutes the next night, then you catch up with a 30-minute nap or might sleep in a little bit on the weekend. But sleep deprivation is essentially that cumulative effect of not getting enough sleep.
But what about children? Tell me about sleep deprivation in children.
So children are interesting. They get a different sort of reaction. When you sleep deprive children, they generally have issues with attention, focus, and concentration. So they present with symptoms very similar to attention deficit hyperactivity disorder, which we've now come to realize that ADHD is directly related to sleep in children.
Wow, okay, so that brings me to school. What is your opinion about school start times?
School start times, particularly in middle and high school students, should start later. 8:30 seems to be the magic cutoff time, and in school districts where they start middle school and high school after 8:30, they get higher SAT scores, higher GPAs, lower truancy rates, lower issues in terms of car accidents from people falling asleep at the wheel driving to or from school, and improvements in mental health issues, including cutting down on suicide attempts.
Okay, and what causes sleep deprivation in children?
So I think not blocking enough time out of the day is probably the biggest impetus to children getting enough sleep.
How many hours of sleep do they need?
Children, depends upon the age. It's an age-dependent thing. Toddlers maybe 11 or 12 hours of sleep, where a high school senior surprisingly needs substantially more than an adult, still requiring somewhere around 8 or 8.5 hours of sleep.
Okay, so help parents make sure that they're setting their children up for success here and they can have the best quality sleep.
So I think parents being conscious of their children's schedule is super helpful. A lot of us step back once our kids are able to put themselves to bed and we don't have to deal with the process anymore, but still understanding when your kids are going to sleep, when they're shutting off their screen time, and how much time they're dedicating to sleep, goes a long way.
Dr. Rasmus, thank you so much. Where can our viewers go for more information?
They can go to saltzerhealth.com and they can view patient education materials there, as well as a link to our podcast. There's also a website, Start School Later, which is a nonprofit that's working on delaying start times for high school and middle school students across the country.